Bruce, there's a lot that goes into guarding a person's health, and it's not just making sure that they're getting the appropriate care. It's also making sure that they're informed with all of their alternative options. Can you talk a bit about what you've seen firsthand with how that impacts
I've
members?
seen plenty of them. I'll give you two examples. One was a member who was going to have a simple procedure, gynecology procedure. And when I was informed of that, I looked at the proposed cost, and it was close to $20,000. So I asked our team, why is this? They said, because it's going to be in the hospital. So I questioned why it has to be in the hospital. So I reached out to the gynecologist in that hospital. I asked him, and the simple fact was he was doing it because of his convenience, because he was a locum physician. He was not going to be there next week. So he wanted to do it in the hospital. Wasn't familiar with the outpatient system. When I informed him that the facility fee of the hospital is 16 times more than his professional fee, he blew up on the phone.
Wow.
He said, "Oh my God, number one, this is not an emergency. Number two, could easily be rescheduled and done in the outpatient." And to me, again, was the reduction of the harm, reduction of the unnecessary care and unnecessary cost. Another example was one of our members was receiving this injection for a high cost of $2,500 a week. So when I was reviewing the employees of that employer, looking at the list of the medications, this popped out. So I reached out to the member and said, "How long you've been on this?" She said, "About 6 months or so." And I said, "How is it doing for you?" She said, "I'm not sure if it's helping. It actually has added to some of my symptoms." I said, "Would you mind if I reach out to your doctor?" And she said, "Of course." So I reached out to the doctor, and surprising was the doctor didn't remember that this patient has been on this for 6 months because he was going to just try it and try and error for 2 or 3 months. And when I informed him of that information, he said, no, I'm going to call the member and discontinue them. So again, going back to the element of the sick care system, the more is better. The more is better is harming us in every shape or form. Keeping the doctors seeing 60, 70 patients a day so they don't have time to really coordinate and pay attention. And the patients who are paying for this with their bodies, with their health, and with their pocket money and their employer's money.
You had mentioned a story about a particular family who there was a patient who was receiving chemotherapy and it was really impacting them. Can you talk about how your team, rallied around that particular member to truly investigate alternative options?
Sure. My brain has been presensitized from what the hospital system calls the high margin service lines. High margin service lines include cancer, include preemies. These are services that people are emotionally very attached, and therefore the hospital system can do more and more and more. People won't question it. So it was a member who had a multiple sclerosis, so he was using wheelchair, and he had developed a stage 4 kidney tumor. And the stage 4 kidney tumor survival, unfortunately, is less than a year and a half, regardless of what we have done over the past 30, 40 years. So this patient has received chemotherapy and had severe reaction to it. So a member of his family reached out to me and said if I can do anything. So I reached out to the oncologist and said, were you aware of these complications with the chemotherapy and the fact that the fate of this is not going to dramatically change, and the fact that the patient is wheelchair? And she kind of didn't remember. And when I called back the family, discussed the scientific facts of what are the fate of this patient, the natural history of these conditions, they elected to stop the chemotherapy and really spend the rest of the remaining time with their bladder at home with their loved ones.
And how did the family respond when you told them that news, that they could even have an option?
I talked to the next of the kin, who is the brother, and on the phone he literally started crying.
And why is that so important to you, that you have a team that's focused on those moments that are beyond just the transactional?
Because I've seen so many of the patients suffering suffering from, I have seen the harms in action. I've seen them for 30 years. I've seen unnecessary surgeries one after another, that people pay with their bodies, with the quality of life. Forget the cost. I've seen so many of them.
And why is that something that you feel so passionate about, creating this solution inside of an employer environment? Because the benefits, it's almost like people are getting access to the care, but yet these harms are still happening.
Is because, again, to me, the doctors are there to provide a better health. The existing sick care model has created this misalignment. They're doing more and more creating harm. And that harm, that waste, employers are paying for it. And I wanted to disconnect and reverse this course. And I know almost every doctor and every nurse wants to do that. But when there's a systematic misalignment, every individual's attempt basically leads to more dysfunction and more waste. Whereas you disrupt the system and you create a model that is the health guardianship, in my opinion, then the expertise of the doctors and the need of the members are aligned, that delivers the best outcome with the resources are available to us.